to the Hub Internet Show. I'm your host, Joel Aaron, and you may or may not have heard about this kind of obscure topic, but we like to cover those kind of things here on the Hub Show. And last week, we learned that our own U.S. Navy has been, avoiding the animal rights groups quite nicely for the last 6-8 months, because they've been dropping frozen mice onto the island of Guam. Because they've got a problem with green tree snakes in Guam now. It's overpopulated. The island is overpopulated with green tree snakes, and they're eating a lot of the native species, and they're losing a lot of the native species on the island. So they're dropping dead frozen mice, pumped with acetaminophen, wearing little jumpsuits into the trees, and it's like a little ice, like little mice-sickle. And it just lands in the tree, and they have a good meal, and then they keel over and die, fall off the tree. It's gory, it's messy, but I had to paint a visual for you. And honestly, I don't see the biggest concern here is Congress. We know what will happen if we continue to drop too many frozen dead mice onto the island of Guam. At least Congress does, and we had a video for that. But those are the kind of things we've got to prevent. When you think about this, the mice to green tree snake quotient, how much is too much? How far is going too far? It's really not about animal rights at this point. It's about saving the ecosystem from an upside down disaster. Greg, what say you?
Well, I mean, Hank Johnson obviously must have something to do with this legislation, because bombing Guam with frozen mice, that'll make that damn island tip over.
He is an ecosystem, I think, in himself. Like, you watch the stuff on C-SPAN, and I think the man has a point, and it's something we should be concerned with too, especially the U.S. Navy.
Well, I'm concerned that we're going to create another, kudzu scourge, because, so we've bombed the place with frozen mice, the mice everywhere. Now we have to drug the plants they eat. So then we drop in acetaminophen-laid kudzu, and then it takes over the mountain or the island. Yeah. And look,
it just gets more intertwined and complicated.
This is a perfect moment for the application of a top secret classification to information, because really, the people don't need to know that we're carpet bombing an island with frozen mice.
Forget you saw this YouTube video, all right? You didn't hear about it here.
There's some things that are just so asinine and insipid that no one really needs to know.
It's like a New York Times editorial comment. We don't know if it's true or not. We're just throwing it out there, all right? It could be a health hazard, but for more than just the green tree.
If you're the guy who gets hit on the head with a frozen mouse,
that's a health hazard.
From 5,000.
Speaking of health hazards, there's another one going on right now. The ObamaCare is being slowly implemented as time goes on. Now we are learning that at least two companies, 3M and now Mickey D's, are looking for a way to back out of ObamaCare because McDonald's, for example, has had these mini med programs that they've had for a long time, and it's basically it caps the amount of healthcare of coverage that you can get. It does not give you it does not give you catastrophic care. There's a lot of things that these plans don't give you. It gives you the minimum amount of coverage possible. Well, McDonald's is now saying that ObamaCare sets a limit on how little care you can provide in a health care plan. And so since the mini-med plan does not cover up to that limit, it's going to have to be phased out. And Mickey, honestly, I don't see how they've made it this far with the health care policy that they have, because everybody knows you go there long enough, you have a coronary. And I think the best thing, best health policy they could have is just to give them a per diem, all the employees, to go across the street and eat at Subway 6-gram sandwich shop. And that's about it. But Greg, it was just a matter of time before this happened, right? I don't know why we're unbelievable.
Well, Catherine Sebelius, the Human Health Services Obama's, I don't know if she's an official czar, actually, if that was an appointed position.
She's now the hottest Lottie date in DC.
She is, unable to, take any of this news that these companies are letting go of their health insurance because of Obamacare. She's like, oh, you can't say that. It's not because of Obamacare. Well, the companies are going to be dropping coverage, and the insurance companies are going to raise premiums directly because of Obamacare, whether Kathleen or Obama likes that or not. It's a fact. The insurance companies were not making egregious profits. Their margins are only 4%. And so if they have to keep raising their premiums to maintain 4%, there's nothing innately wrong about that choice.
Well, I mean, and Obama, Whitney, said that we're going to, if you want to keep your health care plan, you can keep your health care plan. Nobody's forcing you to get rid of it. And we're going to work our butts off to make sure you don't have that
Which
option.
more and more people, I don't think McDonald's is the only one who wants out of Obamacare. I think the more people learn about it, everybody wants out of Obamacare. And I think it's hilarious that you can have too little health insurance, but it's okay for us to drop you completely under the plan. So now you've taken people who at least had some coverage, and I think the article said that they're all younger, they're at McDonald's, their restaurant employees turn over like 75% of the time in a year. So they were doing something for them, even though they're part-time, they're not on salary, they're just hourly workers. Yet they had some coverage, now they'll have none.
Yeah, because, I mean, you're right. At this point, you're a lot of younger folks. They're not going to get sick as often, and they're probably going to be transient in their jobs. They're moving somewhere else anyway. You know, at the end of the day, though, how do you restructure a company with 29,500 employees like this to get around that leak?
You know, here's the dismal portion of the program when the economists start speaking. At the end of the day, Democrats habitually and cynically refuse to acknowledge basic economic principles, which is that if I have some health care coverage with a GED, that's better than no health care coverage. A low wage is better than no wage, and I'm not trying to rhyme like Jesse Jackson. What the Democrats do is they sit here and go, you know, they say that some benefit isn't enough. You have to get this high threshold benefit. Well, you know what? The people who have those have 40-hour-a-week full-time jobs, and if you want the same benefits as Darrelle Revis, well then become Darrelle Revis. If you want the same benefits as someone with a 40-hour-a-week job, then go do the things that they've done to build their skill set to get to that point. And the flip side, and here's the dark side of all this, which is that, whenever Democrats talk about public companies, and focus on public because that will become important for all you liberals listening. Public companies aren't owned by that guy from the Monopoly board with the monocle and the spats and the top hat. They're also owned by, as public companies, they're owned by pension plans for unions, teachers' pension plans, firemen's pension plans, regular people. They're not nefarious, evil, robber baron capitalists. They're people who, strangely enough, would like to see their stock price, their retirement plan go up via, say, cost measures like this one. So are they evil? Where do they hide their spats and their monocle? And, Mr. Main Street with a retirement plan, is he some nefarious robber baron? No, he'd like to see his McDonald's stock
Greg,
go
you're a
up.
mortgage shark. What say you?
Well, I was just wondering if working at McDonald's is a pre-existing condition, and if so, then
It will be within about 3 months.
It's looking that way. You're able to get coverage even though you have that on your resume.
No, it's a condition created by the City of Atlanta school system.
Well, see, here's the thing, and this is where some folks are saying you're just so sick of Obamacare getting such a bad rap because it's taken England since World War II to have its universal health care catch up with it. So we have some time here to figure it out and to provide as much for as many as possible.
Meanwhile, we'll be bombed by Germans.
Or mice.
Or mice, either way. So, and there's no, for the record, they don't have a death panel in Britain. Everybody's always saying there's a death panel in Britain. No, they have what is this called? The National Institute for Health and Clinical Excellence. Or NICE. And that's just nice. They use a quality-adjusted life year to see if your quality of life deserves the drug you want. That's a killer incentive, I think. Greg, so split hairs here.
I think I'm going to have to read the tea leaves.
Yeah, well, that too. And we'll all be reading those on for a second. We'll see you tomorrow on The Hub.